everyone, and welcome to the Substance Abuse and Mental Health Services Administration's webinar, States Telling Their Prevention Story. We're excited to bring together prevention leaders from across the country today to share strategies and successes. Before we get started, please note the views expressed today are those of the presenters and not necessarily the views or policies of SAMHSA, HHS, or the federal government. We will begin with remarks from Jean Casey, Health Communications Specialist at the Center for Substance Abuse Prevention at SAMHSA. Please join me in welcoming Jean. Hi, Jean.
Everybody, good to be here today. So prevention, what's prevention all about? Prevention helps us get ahead of substance use and mental health challenges so that individuals, families, and communities can thrive. We aim to prevent substance use in the first place, prevent the progression of use to a disorder, and prevent consequences associated with use. And we have the prevention playbook to do so. Prevention strengthens protective factors and it reduces risk factors in individuals, families, schools, communities, and society. Prevention science, with decades of research and community-based experience, shows that prevention works. And each October, we celebrate Substance Use and Misuse Prevention Month, which lifts up prevention and the positive effects of prevention on communities across the country. And you can check out our toolkit at samhsa.gov/about/digital-toolkits/substance-use-prevention-month. Back to you, Crystal.
Thanks so much, Jean. Now, please join me in welcoming Robert Morrison. He's the Executive Director at the National Association of State Alcohol and Drug Agency Directors, also known as NASDAD. Robert brings deep expertise in alcohol and drug policy. Then we'll hear from Patricia Zuber-Wilson, Associate Commissioner for Government Affairs, Community Programming and Relations at the New York State Office of Addiction Services and Supports, Vice President for Prevention at NASDAD, and also the President of the National Prevention Network. Welcome, Rob.
Thanks a lot, Crystal. And yes, I'm Rob Morrison. I serve as Executive Director of NASDAD. That stands for the Association of State Alcohol and Drug Agency Directors. It's a privilege to welcome you to this important webinar. First, I'd like to thank our state leaders on the call today. Thank you for taking the time to share ways you're advancing prevention by telling the prevention story. I'd also like to recognize our partners at SAMHSA and our partners at the Center for Substance Abuse Prevention. Our association is a national nonprofit composed of leaders that manage the publicly funded substance use disorder service system in states, territories, and District of Columbia. Our mission here is to help promote effective and efficient substance use service systems across the country. We're located here in Washington, D.C., and we're governed by a board of directors. We're led by President Sarah Goldsby. She is from the great state of South Carolina. And please know, in addition to state directors, our membership includes component groups, and these groups are made up of staff. They staff state directors to focus on either a population or part of the continuum. And the very first component group that was formed underneath the NASDAD umbrella was the National Prevention Network, also known as NPN. It's a privilege to support these prevention leaders, to help them convene, chair, and partner with the federal government to translate the latest science into everyday practice. And every 2 years, these prevention coordinators choose a president as its leader. And it's a very important position because the president of the NPN sits on the board of directors of NASDAD. And this approach ensures a voice for prevention in our leadership. And today, I have the privilege of introducing the NPN president from the great state of New York, Pat Zuber-Wilson. Pat, thanks for your leadership. The floor is yours.
Thank you. Thank you so much, Rob. It's always a pleasure to be part of this event and to really have an opportunity to about the work that we are doing across the country. Thank you. I want to say greetings to everyone, the prevention professionals who are joining us for today's presentation, telling the story of prevention. I want to thank our colleagues at the Substance Use and Mental Health Administration and the team for the Center for Substance Use Prevention for their support and their work with us. And of course, I want to thank our colleagues at NAZADAD. We could not do what we do without your support and providing us with a forum to talk about what's happening in our various states. On behalf of the prevention coordinators from across the country, we want to thank you for your amazing work to prevent and or delay substance use and decrease substance misuse across communities, across this country, across the lifespan. The work that you were doing is so important. From 2013 to 2023, the 10-year trends that we saw in the Youth Risk Behavior Survey showed that we have decreased substance use among youth across this country. The data is important. It tells us the trends. It helps us think about the strategies that we're implementing in communities and making a difference. The data is so important. It shows what we are doing. But what's also important is telling the story about our work. We need to let people know, not only during Prevention Month, but throughout the year, the wonderful work that we are doing to advance prevention, substance use prevention in communities. Today, two of my colleagues from Connecticut and Texas are going to talk to you about the wonderful things that are happening in their great states. What I want you all to do is listen, and if nothing else, take away one thing that you may say, this is something I need to look at for my state, for my community, to make a difference. Every time I'm with our coordinators from across the country, I learn something new. Take this opportunity to learn something new and to see what's happening across the country in different states. So with that, I thank you for your amazing work. You are making a difference. We know that. We need you as our partners to tell the story of prevention. And with that, I thank you and turn the session over to our moderator.
Thanks so much, Pat. We so appreciate having both you and Rob here to bring that NPN, NAZADAD, and even New York State Office of Addiction Services and Supports perspective to this conversation today. So now let's turn to specific state perspectives with Kelly Schultz from Texas, and then later Sarju Shah from Connecticut. So first up will be Kelly. She is the National Prevention Network Director for Texas and the Deputy Associate Commissioner for Prevention and Behavioral Health Promotion for Texas's Health and Human Services. She'll be sharing with us Texas prevention story, including system redesigns. So looking forward to that. And then she'll be followed by Sarju Shah, who is the National Prevention Network Director for Connecticut and the Director of Prevention and Health Promotion Division, Connecticut Department of Mental Health and Addiction Services. She'll share with us Connecticut's prevention story, including its fatherhood initiative. So let's turn it over to Kelly. Welcome, Kelly.
Thank you, Crystal. I'm excited to be here today. So as Crystal mentioned, I'm the Deputy Associate Commissioner for Prevention and Behavioral Health Promotion here at Texas Health and Human Services Commission. and I'm excited to share our Texas prevention system. I will be talking some high level about our state and our prevention system overall. Then I'm going to be honing in on specifically talking about SINAR and our retail violation rates, and just providing a brief history and some more information on the problem and the challenge that we were trying to address here in Texas. Then I'll highlight some successes, outcomes, and end with some lessons learned. And so just a little bit, our Prevention and Behavioral Health Promotion Unit is part of Behavioral Health Services Division at Texas Health and Human Services Commission. Our prevention unit is responsible for providing support and funding and funding programs, to improve behavioral health in Texas. We have an alignment of both substance use and suicide prevention initiatives in the state as really a design to enhance our Texas prevention system. Our agency, Texas Health and Human Services Commission, is a contracting agency, and so we contract with over 60 agencies across the state to deliver evidence-based programs, recognize signs of suicide, and work collaboratively towards prevention by promotion of both healthy people and healthy communities across Texas. We utilize our prevention block grant dollars to focus on 4 priority areas in the state, with that being underage alcohol use, preventing the use of marijuana and cannabinoids, preventing the use of commercialized tobacco and nicotine products, and then prescription drug misuse. We also have the Texas Targeted Opioid Response Initiative, which utilizes SOAR funding, and they provide resources to raise awareness about prescription opioid misuse, how naloxone can save lives, and other information to prevent substance use disorders. And so then I'm going to talk a little more about our Texas prevention system. I think there may have been a slide before this one, hopefully. Oh, yes, perfect. So I'm going to talk a little more just about our Texas prevention system. So Texas is the second largest state in the union. We're being surpassed by Alaska in size and California in population. And so due to our geographic size, it prevents some different challenges. We have a total of 254 counties throughout our state, as you can see the picture of Texas, and that holds our 31 plus million residents. And so as you can see on the map, we divide our state into 11 public health regions, and this regional approach helps us to coordinate and deliver services specific to that community or that part of the state. But more specifically, what I want to highlight regarding our prevention system is that over the past several years, there has been an increase in intentionality to really redesign how we approach prevention services. And we have been moving away from focusing solely on stopping risky behavior to strengthening protective factors and empowering our communities to lead and design programs that really work best for them and their specific community. And some of the ways that we've approached this is by ensuring that we're making data-driven decisions, that our programs are rooted in evidence-based frameworks, and that we're using that data to really inform the decisions in our program design. We've been shifting the needle to focus on upstream prevention with an upstream focus that's really starting to look at non-medical drivers of health and those underlying causes to build resiliency and to build healthy families and supportive communities. By moving in this upstream direction, this has resulted in us really looking at shared risk and protective factors and focusing more collaboratively across our state system on a local level to not only amplify our reach and our resources, but ensure that there's a coordination of services to avoid duplication on a local level. That's really critical for our state just because of how large it is. We really want to make sure that we're not duplicating services and that we're really just being the best stewards of our funding. And so by doing this, by looking at shared risk and protective factors, we've moved away from negative messaging to really focus on positive messaging that's addressing social norms or behaviors that we want to encourage and we want to see with our community members. And all of that is really helping us look into a sustainable impact, that we want to make sure our programs are outlasting the funding and that we're making sustainable changes in the community, such as policy or changing social norms or enhancing our environments. And so for today, what I'm going to focus specifically on, next slide, please, is really looking into one small but large complex piece of our puzzle. And so for those of you who are with us today who may be unfamiliar with SINAR, SINAR is a federal amendment that as a recipient of block grant dollars, we are required to address. And so each state or territory who receives block grant dollars conducts annual unannounced inspections of tobacco retailers, and we report those number of violations or illegal tobacco purchases by minors. And as a recipient, all of us are required to maintain a retail violation rate of below 20%. And so prior to 2020, as you can see on the screen, Texas has had a very consistent retail violation rate. We were almost in single digits every year up until 2019. And we call this where we enter this perfect storm for the tobacco landscape to change. Because in 2019, Texas passed Tobacco 21 law during our 86 legislature, and then soon following the federal law was passed for Tobacco 21. And so there was a lot of confusion about laws and what compliance looked like. And we also saw a decrease in our tobacco enforcement funding. And then in 2020, we had the COVID pandemic. So we just had change after change after change. And during 2020, we weren't conducting compliance checks. We weren't doing undercover buys. And coupling this with the changing landscape of just commercialized tobacco and nicotine products, that's why we call it this perfect storm, because we really just had obstacle after obstacle. And in 2021, as you can see on the slide, what we saw was a drastic increase in our retail violation rate. It doubled from more than 7.2% in 2019 to 14.7%, and then it grew again, and then it just remained stable. And so this really prompted us to dig into our data over the past couple of years and just figure out a different approach to what we were doing. Next slide, please. And so what we started doing was we found that our state had counties that had retail violation rates of 20% or 30% or even 50% in some of our local counties. And of the 19 counties that we selected for fiscal year 24 SINAR survey, 7 of those counties fell over that 20% threshold. And so this increase and this just alarming number of counties that were having high retail violation rates really set the tone that for what we were doing was no longer working, and we really had to take a step back to redesign our system. And so in fiscal year 23, as a state team, we started to develop a small work group and began having several strategic conversations and brainstorming sessions to develop our first action plan. And like any good preventionist, we conducted a statewide needs assessment. So we were looking to identify what are those high priority areas within our state. And these high priority areas became areas that had high retail density outlets. And so most of them were our large metropolitan areas such as Dallas or Houston, Austin, and El Paso. And we realized that these areas had high retail violations and they had some enforcement efforts, but we really needed a more strategic coordination. And then what we did was we realized that the data that we had from either our tobacco compliance program, our enforcement program, or our SINAR program were just all sitting really kind of in our computer. And so we needed a more specific way to share it with the public and to share it with our key partners. So we developed the Texas Tobacco Enforcement and Control Dashboard, which that QR code on the screen will take you to. And so we were using this as a way to really start sharing what we're seeing as a state, what all this data is telling us. And after launching the dashboard, our next step was to improve our data collection mechanisms. We wanted to move away from paper surveys to an online database that our contractors could use to conduct compliance checks to collect real-time information so that we could be more responsive to the ever-changing landscape. And as our team members were developing and improving some of these collection mechanisms, other team members were educating stakeholders on just talking about what is SINAR, why tobacco compliance is so important. And we were being really intentional to not only raise the alarms that this is concerning, that we needed to act swiftly, but what we really soon realized was that we couldn't act very swiftly because we really had to educate and to train our leadership and our stakeholders on just why this was so important. And we wanted folks to understand really what SINAR is, why it's important to our block grant funding, why it's important to our prevention system, and why it's really important to protecting our youth. And so we very quickly adapted to how we talked about it. And then at the same time, when we were working on increasing our state capacity, we had our first big win was we were able to secure a full-time state position to solely focus on tobacco enforcement, to focus on SINAR, and to really help lead the strategic change that we were starting to push throughout the state. Um, and then what we started to do, was we started to increase our funding to our local providers and really adapt their scope of work to make sure that we were just being very strategic, very coordinated, and everything was what we weren't working in silos, that we were really talking from a state level to a local level, and then they were the boots on the ground and really making this work. And so, next slide, please. As we started looking at reducing the SINAR rate in Texas, we focused on primarily 3 CSAP strategies. We looked at education, information dissemination, and environmental changes. But focusing on these strategies led us to developing a multi-pronged strategic approach that everyone played a role in. And this was everyone from our state prevention team to our communications team to contractors and statewide partners. We improved our storytelling, that it no longer became about enforcement or compliance or SINAR, but it just became about protecting our youth and educating retailers on what the laws were, because we wanted them to keep their license. We just wanted to make sure that they were following the law. And we increased our boots on the ground. So we weren't just working with law enforcement and our regional tobacco coordinators, but we started funding our 58 youth prevention providers to conduct compliance checks, but to conduct compliance checks around schools and around their service areas to really reduce the likelihood of youth being able to purchase tobacco products. And then in coupling this boots on the ground strategy, we also added in messaging and a media campaign. We were utilizing our funding to develop a statewide media campaign, one of the first of our kind, that was designed to reach youth, parents, and retailers. And it had a very simple message. As you can see, one of the assets is on the screen. The message was, it's illegal to buy, purchase, or sell products if you're under 21. So it's very short, very sweet, very to the point. And then we knew education was really going to be key. So to complement our media campaign, we developed an online education model that is designed to educate our Texas workforce, our prevention workforce specifically, on tobacco laws, just because it's so complex and very nuanced. Next slide, please. And so just a little bit about our media campaign. Our media campaign was very successful. It focused on addressing behavior of either purchasing vape, cigarettes, or just any sort of nicotine product. And our campaign ran from April 2025 to July 2025 and had over 143 million impressions on all platforms. And so this was a multimedia approach. It targeted youth, it targeted retailers, which was really the first of its kind. We had these targeted areas in our states were chosen on either high tobacco prevalence rates or high retailer violation rates. So we really focused in on where we were seeing some of these purchases. And for different ad tactics, we had social media, we were doing digital displays, we had geofencing around retailers, schools, colleges, malls. We had a direct mailer to retailers as well. And then we had some digital out of home. So we had different ads that were going at the TVs at gas stations, or different screens at convenience stores, bus stops, and waiting rooms. And so we really utilized this multimedia campaign. And I think that's why it was successful, because we really just reached people from a multitude of different platforms. And we had a high interaction rate with both our youth ads and our retailer ads, but our youth ads did perform better than the retailer ad. And it's probably just because it's a larger demographic, and retailers are a little more challenging to reach just because it is a very specific community. Next slide, please. And so with all of the work that was being done in FY25, what really happened was astonishing. In FY25, we had about 27,000 compliance checks, which included follow-up compliance checks for non-compliance. And this was a 40% increase from fiscal year 24. Which is it's huge. And where we really saw this change was our youth programs completed over 10,000 inspections. And so that was something that was not being done completely. And we really tried to make sure that the youth programs were reaching retailers that were around schools, around malls, around where youth have access. And in Texas, we have about 30,000 tobacco retailers. So we really did saturate the market and reach a lot of those retailers. In FY25, we also had 93% of our inspected tobacco and e-cigarette retailers were found to be in compliance with Texas tobacco law, which is an increase from the previous year at 88%. And then overall, we reduced our retail violation rate from 16.6% to 14.3% in 1 year. And this is something as a state we are incredibly proud of because it took a village and it took a coordinated, strategic, statewide grassroots approach to really make this different. But our next steps are, it doesn't stop here. The work doesn't stop here. Next slide, please. Our work doesn't stop here. And so with our database and data collection methods, we're collecting some really rich information and we're monitoring it to identify new trends and target areas in our state. We don't have a media campaign running anymore, but we have coalitions and we have partnerships on a local level, and they are mobilizing and strategizing on how to reinforce this messaging. And we're going to continue this strategic approach and ensure that we're enhancing compliance checks. And we're aiming to reach a goal of 10% for our retail violation rate. So we still have work to do, but we're collecting successes on a local and state level. And we're sharing our story on both a local and state level to just share not only why funding is so critical for us to maintain this momentum, but to highlight how important our action plan was in playing this role. And then we want to share these successes to just highlight the collaborative state work and highlight our win, because so many times we always hear about what we're not doing right or where things are going wrong. So that's why we want to make sure that our prevention story is really being shared and amplified, because it's exciting and it's a big win, and it took a lot of work and a lot of effort to do this. Next slide, please. And so I will just end on a couple just lessons learned. I feel like some of this, y'all know this, that we can change the system overnight. It takes a lot of time. It takes a lot of intentionality. It took me and our team and our providers to be very fluid and flexible. And we had to change our approach and redesign and rebuild because of just different challenges and obstacles we were facing. And it really just required us to be, just try different strategies. And we had to tailor our messaging and our approach to our audience, that we couldn't just talk about SINAR and the retail violation rate. We had to make this digestible and to say that it's about preventing youth from purchasing tobacco products. And I think where we as a field is, prevention is a science, and our field really needs to lean into the strengths about being adapted and building relationships and being creative, because I think what we did really embraces that was changing and improving our SINAR rate wouldn't have happened if we didn't have the relationships that we had throughout the state. And we use those relationships to find our champions, to find the people who are going to take this message, whether that was on our leadership team or just stakeholders throughout the community, to develop new partnerships and really opportunities to share this story. And at the end of the day, as we want to be humbled, but we have to share our story, and we have to share it in an impactful and quantifiable way. Because if we're not going to advocate for ourselves and our field, who is? And so I'm honored to be here on behalf of Texas to really share all the work that we've done, and really just share, next slide, please, it's my closing slide, but really just to share everything we have done. And if there's ever any questions, please feel free to reach out to myself or the team on the email address that's on the slide. And so thank you. And I will turn it over to you, Sarju.
Thank you. Kelly, that was fantastic. I just have to say, congratulations and kudos on getting your RVR down. That is so difficult to do. So I just have to give you a round of applause right there. So hello, friends. I just wanted to say hello. My name is Sarji Shaw. I'm the director for the Division for Health Promotion, Prevention and Health Promotion Division within the Connecticut Department of Mental Health and Addiction Services. And just as a quick update for that, the Department of Mental Health and Addiction Services, or DMAS, as I like to say, it really focuses on substance use across for those over the age of 18. However, we're legislative mandated to provide primary prevention across the lifespan. So I'm very lucky to be in an agency that really supports primary prevention and the work that we do. So I get to tell you a little bit about a prevention story and about really the Fatherhood Initiative in Connecticut. So what I wanted to do is start off with a question. And this is just for you guys to all think about. And it's really about how many men or how many males are engaged with the prevention initiatives within your organization. And this is for a hot moment, just for you guys to think about and look at what that looks like in your organization, within your community, in your region, in your state. What I can tell you here is that one of the historical populations missing from substance use prevention in Connecticut is men. And if you look at the photograph above, like in our little picture, if you click on, just move forward, thank you. What you'll see is in this picture, it's mostly women. There are two men that are showcased there, and one is actually from SAMHSA. So there's only one gentleman that's from Connecticut who's representing some of the work that's here. And what I wanted to show about this is that the workforce itself, as well as our engaged audiences, have always been made up of far more women than men. Our coalition coordinators, coalition representatives, and those engaged populations within our communities are always women. And the people attending community events, school, open houses, women, mothers, and teenage girls. And when we think about that, how do we engage men? How do we talk about our prevention story? And how do we, as a state, and what I'd like to do today is really about how do we address involving men, particular fathers, into prevention efforts. And what we're trying to do here, and what you'll see, is we're going to be touching upon the challenges and lessons learned of what we're doing here. Next slide. Thank you. So the Connecticut Fatherhood Initiative is a statewide program aimed at encouraging responsible fatherhood. It focuses on improving outcomes for children by fostering emotional and financial development from fathers. And this is the work that's happening is really part of another state agency for social services. So in an effort to really directly engage men and specifically fathers, Connecticut DEMAS really teamed up with the Department of Mental Health, the Department of Social Services, and worked with 8 father-serving agencies. Now, the Connecticut Fatherhood Initiative is a statewide collaboration of state agencies, and it's led by the Department of Social Services. And through this partnership, DEMAS has the ability to provide prevention training and programming to enhancing the role of fathers really being a positive influence on their children. So this initiative really recognized the importance of the role of parents, especially dads, in preventing children from using and abusing substances. We're building on a father's communication skills and their knowledge about substance use. And hopefully by doing that, we're yielding positive outcomes. So DEMAS funds 8 part-time case managers in these father-serving agencies to be trained in the SPIF, prevention strategies, and drug, alcohol, and mental health and gambling facts. Like, we're really trying to give them a whole gambit of information. Next slide. And then the CFI, the Connecticut Fatherhood Initiative's goals, really goes just beyond just encouraging dads to be present. It really provides the tools and resources to help fathers become emotionally supportive, financially responsible, and mentally healthy. Now, these goals are especially critical for fathers impacted by substance use. The Fatherhood Initiative itself addresses root causes of substance use, such as trauma, disconnection, poverty, lack of support. And it's about what we do in prevention. It's building protective factors. It's about parental engagement, economic stability, emotional regulation, and as well as community connection. And it all aligns with the SAMHSA strategic prevention framework. And we've really focused on the fact that we want to address the risk and protective factors at multiple levels. So these 8 father-serving agencies are located in major urban centers within Connecticut. In total, these agencies serve roughly about 400, primarily African-American, Hispanic, and some Caucasian backgrounds, as well as those that are aged between 25 and 45. And what we're trying to do with them is, the 400 fathers that we engage, this is on an annual basis, and these are for their social and career service needs. And these dads are also engaged within an 8 to 12 week parenting course called 24/7 Dads. The case managers really braid in prevention knowledge into the existing curriculum for the 24/7 dads, so that the men graduate the program not only the parenting skills, but also an understanding for prevention. The case managers that we work with have become really part of our prevention workforce. And then there's about 12 of the case managers that we help participate and have been trained and are training other men. These case managers we've helped them and supported them to help them understand what prevention is. They've attended CADCA, NPN, the Connecticut Prevention Summit. They've also participated in, our Connecticut National Prevention Week. And other activities throughout the year. And what we're trying to do is really giving them the aha moment. Like, what is prevention? Having them recognize the fact that each and every one of us, we're all preventionists, and giving them that baseline and understanding that the work that they do is important and supports what we're trying to do in the long run, in the long term. Now, these case managers also participate in our community coalitions and opioid task force, and also by adding their own perspectives of fathering to the strategic planning process across the state. And if you can go to the next slide. So what we want to do is really about telling that story. So I talked about the different activities that these case managers and the fathers have participated, and you can kind of see the list. So in the last, since 24 and 25, it's about getting them to the table. And we're telling their prevention story by centering fathers as agents of change. And I think this is really important to think about. We're shifting that narrative from absent fathers to engaging them and making them empowered. We're using storytelling, community voices, and lived experience to really showcase how fatherhood reduces risk behaviors. We're also telling the prevention story by centering fathers as I just repeated myself, I'm sorry. But really looking at how we're using these storytelling activities to make that change. Additionally, we're also highlighting intergenerational impact. So how father involvement really reduces youth substance use. So I know I'm saying a lot of words, but at the same time, this initiative has been really shared as an in-person at numerous national, local, and regional conferences, as I mentioned before, and really about engaging them and training them into what prevention makes sense and bringing that all in together. Next slide. So with any sort of, storytelling, we have to think about how do we engage our audiences and crafting our information accordingly to that. So one of the things that we really talk about when we're building this engagement is about understanding what motivates and interests the audience itself. And we look at that as a way, as a point that really engages folks outside. And what has made this really successful in Connecticut is about including prevention. We don't really talk about the cost as much, but we're looking at how do we include the prevention, its existing resources, and literally braiding in information and experiences for people. And the story that and finally, people like to really engage with the stories, and then that really helps them activate their feelings itself. So what we've seen right now is by helping these fathers talk about what they've gone through, their experiences, we're really being able to bring in new populations and engaging different folks of people. And this is really not an expensive thing to do. It's really about that listening to folks, making it relatable, and really bringing in that human element. Next slide. Now, potential barriers. We have to be honest about it. This is a new initiative within Connecticut right now, and our data is really about that, just personal stories. However, in prevention, sometimes getting that data, collecting that data is always a little bit difficult. And sometimes it comes with skepticism, especially when you're talking to legislators, because they want that process data, they want numbers. And sometimes it's difficult to do that within prevention. And that's what we're trying to do. We want folks to understand that there is that not that numbers and that numbers is just part of that story, but really want to expand that to tell a person's what a person is going through, how that feels. And sometimes that gives you more. So as our understanding of this of our program deepens, what we're trying to do right now is also increase that data collection piece. So what we're trying to do now is also adding in that pre and post surveys to measure knowledge gain during the group sessions. We're looking at hosting focus groups. We're looking at, how do we take the father and bring them into different areas where we can provide an opportunity, an avenue for them to speak. So those are the ways that we're looking at these barriers and helping kind of bring them into the table. As well, what we also want to do is, talk to them about how to articulate the why. How are we choosing this strategy, for us that men aren't present and they're not typically within prevention? So how do we bring them out? How do we talk to our local prevention councils? How do we talk to our regional prevention folks and go identify that, like, hey, how do we engage them and bringing them in? Because this is really important. And most people, what we've noticed is really understanding and having that community understanding. So as we know, most people want to hear that story that has the human impact. So that's how we also want to incorporate that in. And the next slide. So I also just wanted to share that Kelly Edwards, we have really looked at the fathering program as a way of bringing fathers to the table. And by bringing fathers to the table, we have to think about it as we have to make prevention easier for people to understand. Think of prevention as a seatbelt. We want to be able to focus folks in, talk to them, engage them, and having them participate in that. And the Fathering Initiative is a way of doing that. With that said, Kelly Edwards is a great resource within our division who really focuses on this, and she works on community initiatives of bringing fathers into and to the table itself. And with that, thank you.
Wow, amazing. So many great ideas, so much information that is so actionable for us to bring back to our communities. Thank you so much, Kelly and Sarju, for these fantastic presentations and for sharing your perspectives, your insights into strategies and collaborations. It's incredibly valuable to all of us. So thank you so much. So now let's move into our panel conversation. And so I have a few questions to pose to our panelists for them to share their unique viewpoints and build on each other's ideas that we've already kind of heard about from their presentations. So my opening question is, what are you most proud of that prevention has accomplished in your state? And why don't we start with Kelly first?
Sure. So I think aside from what I shared about SINAR, because it really was a huge accomplishment, but aside from that, our state team has been really intentional the past couple of years to move the needle on prevention, to focus on upstream approaches, which is what I started sharing a little bit, and to really make sure that we're addressing shared risk and protective factors. And about 7 years ago, there was a heavy emphasis on those 4 prevention priorities that I spoke about earlier, like reducing underage alcohol use or marijuana and cannabinoids. But the framework now has broadened to include focusing on the correlation between mental health and substance use, integration of suicide prevention, designing programs that impact truancy, and just making sure that our services are so integrated that they're addressing the built environment, that we're not just focusing on reducing one particular behavior. And we've been doing that by leveraging our partnerships, developing new ones, strengthening old ones, to really just showcase that our field is not siloed. And one of the things that we did, I'll end on this note, is we reevaluated as a team our curricula and selected new ones that focus on building resiliency and enhancing skill sets. That we fund our youth prevention programs on. And we developed a social norm campaign to focus on positive behaviors that we call Turn To. And we're just ultimately trying to make sure that prevention is at the table when we're talking about substance use, when we're talking about the continuum, because prevention's at the heart of what we do.
Great. Thank you so much. Sarju, same question. What are you most proud of that prevention has accomplished in Connecticut?
So for this program, this has always been part of social services. So we were so fortunate to be able to participate in that. And when we were participating, we were like, how do we support as a state agency, as mental health and addiction service, how do we support fathers? And I think what I'm really proud of is in the past like 2-3 years, we've really been focusing on how do we embed prevention programming into this initiative to help strengthen family bonds. Like, we talk about protective and risk factors, but it's about strengthening those family bonds. It's about promoting positive role modeling. And, one of the biggest things that we have to think about is that, we know that having fathers engaged and present can help children become stronger, and they're building stronger parent-child relationships. And it also helps, like, and as we know, it helps children less likely engage in risky behaviors. And I think what we're trying to do is really build and strengthen a ground up, a program that's going to support building those relationships. And I think that's what I'm really proud of.
Amazing. And just from listening to both of your presentations, it's clear that you're reaching out to a lot of different audiences through your work. So, Sarge, I'm going to start with you. How do you tell your prevention story to the various audiences in Connecticut?
That's always the fun question, Crystal, because it's like, what do we do? And it's always about looking at different modalities of how we support the program. So I think the first thing we always have to think about is grassroots. Right now it's working with case managers in these programs and making them understand that they are preventionists. I think that's number one, is like everyone is a preventionist. Everyone who looks at how do we help support kids? How do we delay substance use? They're a preventionist, and giving them that like realization and that moment. And I can tell you from that level, when it clicks, there's an aha moment that happens. And when that is what we're trying to strive for, and then once we do that, the buy-in is there. There's a strong buy-in, and that's what we're working on. And also it's, what we've tried to do with, and I'm going to talk about case managers, but I wanted to start off first there. And it's also being able to incorporate them in, going, hey, we have a prevention infrastructure. And it's kind of like forcing them into a group, like our family activity when you don't know who they are. You're just like, nope, you're coming. We force them into it. We're like, you're going to love us either way. And we really made them connect with our regional or local prevention partners. We keep inviting them into these activities. And I think that has made a really big difference. And we've also worked with fathers. Like, we're helping them do basic things like, let's create fun activities for families. Let's have you participate in fairs, tabling events, see other people, make those connections. And then we're also looking, so like we're building that relationship, we're building them into that they are part of the system itself. And when we're looking at a more of a broader perspective, we've also reached out to like other case managers, social services, people who may not think that they have a role in prevention, but they do. We really focus on that. And I think what we've always trying to do is we raise our hands like, hey, we volunteer. We want to be at the table. How do we be at the table? So we've been able to, like, and I'll give you an example. They have a New England Fathering Conference that happens where all the fathering agencies from the New England states come together And we have said, like, let's talk about prevention. How do we work with you to talk about prevention? How do we make it action steps for you to work with your fathers or for fathers to work with their kids? And we make it fun, make it easy for them to go, these are basic things that you can do today, tomorrow, etc. And we're also looking at core messaging. And I think that's something that we always get a little confused about. We have so many acronyms. Wherever you go, there's a new set of acronyms. How do we build into that? So we look at the fact that we kind of have to look at it from a different angle in essence. And we really focus on a couple of things. It's building the trust, it's raising awareness, and it's always encouraging participation. As well as really thinking about it, it's empowering people, it's engaging folks, and inspiring changing their behaviors. So if we focus on this, and that's what we've been focusing on, it's really made a difference.
Great. So it's always like a combination of finding channels and ambassadors to kind of make those connections with the audiences you're trying to reach.
For sure.
Right?
I was like many years ago, I was like an RA, resident assistant in college. And I feel like I'm bringing that back to the table of like, how do we bring people together? How do we make a safe environment? And I feel like that's what we're always doing. And you're right. It's being that ambassador, being that champion.
Mm-hmm. How about you, Kelly? How are you telling your prevention story to different audiences in Texas?
Yeah, I really like that approach of being the ambassador. And what we've been trying to do is making sure that we're tailoring our messages to the appropriate spokesperson and making sure that we have those champions on all different levels. We have someone in our state leadership team, that we have a champion on a local community. And as I was sharing, because our state is just so large and so geographically diverse, messaging that may work in Austin in the Central Texas area is not going to work in North Texas or work in South Texas. And so when when we have our media campaigns, we want to make sure that people see themselves in the campaign and that we really we're trying to find things that just resonate with the everyday Texan. Um, and so we've been developing on a state level that our providers can use. We're trying to develop different items to showcase our programs and their impacts. And so this is everything from impact reports to one-pagers to taking all of this information and saying, and you don't kind of piggybacking off of what Sarju said, is that making sure we're not using jargon. And so trying to take this messaging and we're simplifying it into like a return on investment document to just show that this interwoven web of prevention strategies, that they're not only working to reduce like prevalence rates, and we're not just reaching 1,000 people or 1 million people, but that this is the impact that they're having in our state, and that we're changing the landscape of where Texans live, where Texans work, and where Texans play. And one of the ways that we've been having to also do this is engaging providers that we fund, and we added in success story deliverable into all of their contracts. So every year they submit a success story to us, so that we're also creating this library that we can pull from. So whenever something happens, we can make sure prevention's at the table and we can share all those wins and all those positive stories, because I think that's what makes prevention really unique, is that we have those positive stories.
Amazing. Well, and you all have been doing this work for a long time, and you know well that working in the prevention field, we face a lot of barriers, and that could be from limited resources to like a very diverse population that we're trying to connect with. So Kelly, how have you and your team overcome some of those barriers to telling the prevention story in Texas?
Yeah, that's a great question, Crystal. What we've been really doing is, as we started redesigning our system and really focusing on telling our story, it brought to light that we need different mechanisms to collect the information. And so one of that is what I shared earlier, is that we want the field to share their stories with us. We want that firsthand experience, whether it's qualitative data, quantitative data. And we have a lot of databases and we have a lot of systems that really showcase the reach and the number of people being served, but we're really just trying to impact, and we're really trying to show the investment of what we've been doing to enhance our system to focus on impact. And so as I feel like as we've been sharing our story, all of these barriers have been coming to light is that we don't have these mechanisms to collect information aside from reach. And so we've been spending some time as a state to develop some new contracts, to develop some new processes to ensure that we're collecting this. We developed that tobacco dashboard that I mentioned to just make sure that we're sharing this. We're sharing this with the field. We're sharing this with people who can then take it and pitch why they need more funding on a local level. And I think just a continuous challenge that we have is just the size and complexity of our state. Having over 200 counties, having 11 public health regions. I mean, some of our public health regions are bigger than states in the US. And so we have all of this just geographically diverse areas. And so just figuring out how our workforce on a local level can collaborate and strengthen some of those initiatives. And one of the things that we're trying to overcome that is our prevention resource centers, which we have one in each of those 11 areas, are being tasked with developing regional alliances to increase this collaboration across the regions and to serve as information and resource hubs. And so I feel like every time we pull the onion back, peel the layers back on telling the story, just new challenges and barriers come up. So, Sargent, I'm curious to hear kind of what you've encountered in Connecticut.
Um, oh, I think Kelly, we're in the same boat. So one of the areas, because I'm an epidemiologist. That's where my background is. I like data. I like being behind the scenes, not in front of the camera, looking at what the data looks like. And I agree with you, Kelly. Like having just processed numbers doesn't really help us. Like numbers served doesn't get to the point of like, are we making a change? Are we making a difference? So we're seeing totally the same thing. And we're doing exactly the same thing is we've just started in Connecticut. And I don't know, and Kelly, we haven't talked about this too, which cracks me up. We've done the same thing. We're embedding in all of our contracts that they have to provide a success story. They have to share their challenges and their barriers. And we want to be able to start really looking at that so that we can know how to move and change. And so we're doing that. We haven't gone into the dashboard yet. That's my hope and dream for 2026. But I also just want to say that, as a state agency, that's what we're looking for is it's that data pieces of it. But I think at a local level or at a regional level is like it's also about the storytelling pieces of it. And one of the things that really impacted me and the way that I look at prevention is we're a sideline character. We're the reliable, safe human being on the side that's going to take care of everything. We're not the drama people. We don't create drama at all. But you want to know something? What the drama person has that we tend to stay away from is that main character energy, and that's the thing that we're trying to do right now in Connecticut. Is prevention is a main character. We bring the main character energy in, and we focus on that. And I think that's so important, especially for those who don't have that data piece right there. Is the storytelling. It's being able to talk about the positives. Don't talk that there's 1 out of 4 kids are using cannabis. Talk about the fact that 3 out of 4 people are not using cannabis. We're making that difference. And talk about, like, flip the switch a little bit, flip that script so that we're talking about those positives. And I think that's really important. And it's about the reframing of the narrative piece. And also, prevention isn't a competitor. And I think that's like the part that we also have to ensure that folks know that we're not the competitor. We are foundation and we're foundational. So we're like wearing the seatbelt. We should be at the table. We're gonna support you. Let's figure out how do we embed prevention into the current activities. How do we get ourselves into it? That's what we did with fatherhood. We're like, we see a problem. Prevention can help fix that. Let's be at the table. And I think that is the way that I feel like that we can overcome those barriers. As well as data, because data is also very important.
Yeah, always important. But I did write down in my notes, Sarju, make prevention, bring it main character energy. I love that. I love that positioning. Well, before we close, I'd love to open it up to our other speakers that joined us today. Pat, or I know Tracy Flynn representing NASDAD, and if any of you have, or Jean, any closing thoughts based on the conversation we've had today? Anything you'd like to add or share? Pat?
Yeah, well, first of all, Sarju and Kelly are just absolutely wonderful, and I learned something new every time I meet them. I've already written some notes down on some exciting things that are happening. And I want to thank them again and again and again because we really appreciate you telling the story of prevention. It is a challenge. We know it's a challenge. It takes a while for the data to catch up with the work. And that has been, I think, some of the biggest challenges I've had here in New York State is really thinking about how do I explain to people that this is working in a way that touches their very beings, because they're numbers people, and then there are people that like to hear the story. And I think when you bring the two of them together, it really illustrates the importance of our work. One of the things that all of us are talking about is prevention across the lifespan, and how important it is that we continually remind people that, you know, that substance use and risky use is a challenge, and we really want healthy communities, and that is the work that our teams are doing across the country. We thank the support that we get from all of our colleagues, from SAMHSA, from CSAP, from NASDAD. Really helps us to build upon the work that's happening in various states. So I thank them. I thank the team here. And Jean, thank you so much for bringing this together. It really is a time for us in the field of prevention. And I always, I say this sometimes, and I said it at the NPN conference. The data is important. I can't stress enough how important data is. But I always look at what we do and how we report it as a coloring book. And the data is black and white. But when we start telling the stories and we start bringing color and texture to what we do, it is so important and it's so powerful. So thank you all for this presentation. I can't say enough how wonderful it's been.
Oh, thank you so much, Pat, for saying that. Is definitely something I have underlined in my notes from our conversation, is that we need the data to tell the story, right? And how important that is. So thank you again for emphasizing that. Any other final closing comments?
I just want to say thank you to our presenters and our facilitators and convening this meeting. I'm always so impressed by the prevention coordinators, NPNs, on the work that you do. And I love hearing your stories. So I think we need to continue to highlight them. Bring color to the data. I like it, Pat. Thank you.
And it's such a privilege to help support the good work of people across this country. It really is.
Oh, thank you, Jane. Thank you. Well, with that, I just want to thank all of you, including Rob Morrison, for being a part of today's event and this really important conversation, and for sharing your insightful prevention stories and insights. Before we go, I'd like to remind our viewers that your voice has power too. And don't forget to share your hashtag #MyPreventionStory on social media. We want to hear it and we want to share it with others. So please join us year-round as partners in prevention by visiting www.samhsa.gov/substance-use/prevention/campaign-events, and utilize the information and resources available on that website. Thank you so much to our panelists and our speakers today, and to all of you who were able to join us, for telling the prevention story and partnering in prevention.